I'm just,
Great.
if I can get you to talk. I hear you're a musician as well.
No, I was a singer in a terrible band. I'm a musical fan. I'm a music fan, but I have no talent whatsoever.
Okay, well, that's very rock and roll. That's the way it's meant to be, I think.
Yeah.
My guest today is Tim Farron, Liberal Democrat MP for Westmoreland and Lonsdale. He talks to me today about his fears over a post-pandemic world and why he and other Liberal Democrat MPs voted not to renew the Coronavirus Act. Is it for government to decide what society we want to live in, or do you think we need some kind of other way? Yeah.
I think that's a really good point. Because I think the argument about because an awful lot of the things that we're to do, distancing, mask wearing, it's actually about being considerate about other people. And shouldn't we just be considerate rather than having the law telling us that we should be considerate? So anyway, but entirely in your hands. Should we?
Well, yeah, we can go down a whole rabbit hole of that in the community mask wearing. There are no studies at all which show any benefit to the community-based mask wear. Lots of lab studies show little bits. And do we want to cut through our social structure? But that is a separate thing. I think, if we talk about mental health, and you're very concerned about young people, we obviously don't have the data yet on any uptick in suicide, although we have seen that there is a huge surge in eating disorders, more emergency admissions. I think in some areas, 80% referrals are emergency when it was normally 20. So what have you seen in your area, and what have you kind of noticed from your work in this area?
Well, for me, we did a survey just either side of Christmas in my community, and we got 1,600 replies, which from one constituency is pretty good. The survey told us a bunch of things. One of them was that young people who, pre-pandemic and during it, had waited ludicrous lengths of time to get into the system. And often, these are people who were expressing extremely dark thoughts when it comes to their mental health that put their physical health, at extreme risk. And yet you had more than 40% of the young people who had been through the child and adolescent mental health services saying they'd have to wait for 5 months or more for treatment. And it just begs the question, why do we treat mental health emergencies like not an emergency? If you're a 15-year-old and you break your leg playing football on a Saturday or a Sunday, it's not life-threatening, it is excruciating, and you are in hospital right away, and you will be seen within a matter of hours at most, and things will be set back in train for a recovery. If something else breaks within you that we cannot see, in terms of a mental health condition, which may be a much bigger threat to your life than you breaking your leg, you could be well waiting for 6 months. And so I think maybe the pandemic has helped to reveal just this inconsistency. We talk about mental health more than we ever did. I'm not sure we are addressing it more than we ever have.
What, from your survey, just sort of going back to that, when you said that also young men were affected and then younger people, in what way, how was that manifesting? Was that just looking at depression, suicidal ideation, or were you talking about a whole range of things? And were you talking about the effects of the pandemic or the lockdown on mental health, or just was it a general? What was the kind of structure?
Yeah. Well, we asked about both, and obviously we people are sort of self-certifying, and so you obviously take what people say with some kind of a filter, knowing that it's not a scientific survey. But no, we were asking people about their experience of lockdown. Did they judge their mental health to be better, worse, or no different over the period of the pandemic? Basically, I think we were sort of 9 months into it at the point that I did the survey. And yes, there was a huge majority of people who said that their mental health was worse, and a very substantial minority who said it was much, much worse. And that affected people across all the age groups. And obviously the triggers were often different. For older people, more often it was because they had literally been bereaved. And for younger people, that could well have happened as well. But the focus was on the complete disruption of their lives, of hopes and ambitions that they had about school, exams, college, university, disrupted and changed. And I think if you look at the impact on the working age population, it's not much different. I think what we've seen the impact of the pandemic being is it's just disrupted people's plans. And we put a lot of hope, and our certainty is based upon knowing we're going to be doing X, Y, and Z. And that lack of clarity, the things that you thought you could depend upon, not being dependable anymore, that is deeply disturbing. And I think that obviously during the pandemic, for those people whose finances have not been devastated, which is a significant proportion of the population, there's a sense in which they have got used to this sort of new normal. And it feels it's not ideal, but there's a comfortableness to it. My worry about the mental health of the nation, well, indeed of planet Earth, but of this country in particular, and of my community, is that as we move back to some kind of normal, assuming that is where we're heading and that the vaccine works and that we're able to continue some kind of normal life again in next few weeks and months, may that be even more stressful than being locked down. My horrible analogy, Lucy, is this. When the 4-minute warning sounds and you rush for the bunker, that is stressful, but at least it's clear what you've got to do. And when you're in the bunker, your walls are close in on you, it's restricting, but at least you're clear about what your boundaries are. Maybe the really stressful moment is when you've got to open the lid and walk back outside and engage with whatever's left. And that's when you've got to make choices in a landscape that feels very different to you. So if you forgive the awful grim narrative or analogy rather, I do think that might be a good one for where we're heading. And so whilst we're all desperate to get back to some kind of normality, yesterday I was able to sit outside with my dad for the first time in months, and it was lovely. But I also think that as we get back to some of these normal things that we used to do, they won't be exactly the same. We'll have to make new choices about the kind of life that we lead. And that actually might become even more stressful. I can't quantify what the outcomes will be, but we shouldn't just think, oh, phew, it's all over. What a relief. I think we'll have to do an awful lot of supporting one another for months and years to come.
And do you think there's the government's done enough to prepare for that? Do you think actually even that some of the messaging around coronavirus has contributed to some of the worries, because that's uncertain, isn't it? You don't know if you're going to kill granny, and people are frightened for their health, and perhaps disproportionately so. So 2 points really there. Have we done enough to prepare for this new landscape, whatever that might look like, and what do we need to do? And secondly, has the pandemic policy of sort of fear-based messaging, which I think is undeniably it is, has that contributed to some of the mental ill health?
Yes, I think two things. I think it'd be really interesting to look at the physical health issues in a moment. First, I think it's worth just thinking what would have happened if there hadn't been a top-down lockdown. How would we have been different? Would it have had a different impact on how we'd lived our lives and how we would have felt about all this? And I think my sense is there would have been a lockdown from the bottom up, and it would have been chaotic, and it would have been comprehensive, and it would have been undirected. So, once you start seeing, hospitals absolutely overwhelmed. And I read something from a friend of a friend who runs a church in northern Italy last February, so, quite some time before we locked down, on the state of their hospitals and their communities. And it was just terrifying. And a response to that, I think, from the community, if the government had not locked down or restricted in any way, would have been people choosing to self-isolate, choosing to not go out, choosing to keep their distance, choosing to try to work from home, and employers saying, well, no, or maybe yes, and it would have been chaotic. So I think the blame, which is very tempting as an opposition politician to blame it all on the government, I think you blame the pandemic, you blame the disease fundamentally for the impact upon our lives. I think there would have been a lockdown, it would have just come from the bottom up instead. But I do think that there have been some parts of the messaging which have not been helpful. And I think from the get-go, the government should have realised there were some physical health conditions through the pandemic that they could have protected against getting worse. And the most obvious one is cancer. So we have seen something like 37,000 fewer people diagnosed with cancer and starting treatment in the majority of 2020 than you would normally expect. So 37,000 missing cancer patients. Where are they? They're out there. They're just getting sicker. And now, why did they not come forward? Well, some of it's obvious, really. People thought, two things. I don't want to trouble the NHS. It's only a little lump. It's probably come and go. It's nothing, So all the reasons people put off going to the doctor in the first place amplified. And then on the other hand, it was a sense, if I go into a medical setting, a hospital setting, I might catch the virus. And so I think those two things combined to stop people going to get checked out in the first place. So a person I know, I represent in my constituency who lives here, who works as a radiologist, said that, and he's looking after the MRI scanners at a hospital in the Northwest, and he said that normally his detection rate on an MRI scan would be 3%. So 3% of people he sees will have cancer. It's now 20% in the hospital that he's looking at. And that's people who obviously put off going to see the doctor April, May, June, July last year, and that cancer has just got progressively worse. And those people, of course, are much more likely to not survive. And that's why I think the government should have seen that in advance. And even if you couldn't have predicted it, after 2 months of realizing what was going on, they should have stepped in then. And the frustrating thing is that 12 months on, there isn't what I would consider a proper, adequate cancer recovery plan to deal with those missing people to catch up with cancer.
And why do you think that is? I mean, Harold, Professor Sikora and other people have often pointed out that there are lots of, I think we spent 2.6 million on the new press briefing room, but not one briefing for cancer or other time critical conditions. What's going on? Do you think we become a bit, we're looking through the lens of coronavirus a bit too much?
It's very frustrating because, so I chair the all-party group on radiotherapy, and I work alongside lots of other people. So Tonya Antonazzi, who's the excellent chair of the all-party group on cancer. So we've worked as a kind of a group of all-party groups to try and put forward a kind of common cross-party, professionally based cancer approach to government. And, we've had good conversations with ministers and good conversations with, Sir Simon Stevens, the head of the NHS. And but we see too little in the way of action, because the reality is that there is a need to catch up. Jeremy Hunt set out not long ago that on the basis of the evidence that he'd seen, that we need to be having a cancer services running at 120% capacity for 2 solid years just to catch up with where we were in March last year. And there's been no sign of that. And in some areas there has been, but by and large not. So radiotherapy, for example, is the clean form of cancer treatment. If you look at 3 basic forms, surgery, radiotherapy, chemotherapy, drugs, chemotherapy, generally speaking, can suppress people's immunity. It's a dangerous thing to do in a virus. You understand why that might not be possible for some people. Surgery obviously opens that, slight risk of infection. Likewise, I can see why in some cases there might be delays there. Radiotherapy does none of those things. Radiotherapy is, safer than going to the barbers for sure. And it is it is substitutionary. So much of what radiotherapy does can do what chemotherapy does and can do what surgery does. And so switching to substitutionary clean treatment is a thing the government should have done at day one. Mm-hmm. To be fair, with 1 or 2 forms of cancer, they've done that, and that's good. But the massive majority, they haven't. And they haven't because they haven't invested in the machines. We have, the great NHS that we've got, but despite the fact that half of all cancer sufferers will require radiotherapy, only 5% of the cancer budget goes on radiotherapy.
But yeah, there's a discrepancy or a shortfall in the amount of money that's being invested in radiotherapy and should be invested, because a lot of the machines will be or are now obsolete. And I know that the government's, I read that there's 32 million or something that they're planning to invest when you actually need something treble that. You're probably better with the figures. Can you hear me?
Well, yes. Can you hear me all right?
Got it. Yeah, absolutely clear.
Great. So, roughly speaking, the entire cancer budget for radiotherapy is about £350 million a year. If I tell you that the budget for Herceptin alone, which is an excellent breast cancer drug, hugely effective, but one drug, that's £220 million a year. So the entire radiotherapy budget, which is for half of all cancer patients in the country, is only 50% more than the budget for one single solitary drug. Well, partly it's because pharmaceuticals are really expensive. And secondly, it's because...
The priority.
But secondly, it's because radiotherapy isn't that expensive. And that's the wonderful thing about it. So I say 50% of the of people with cancer will require radiotherapy. It doesn't need 50% of the budget. So that's the good news. But it needs a lot more than 5%. Pretty much the average amount of cancer spend in equivalent civilized, developed countries is about 9%. So that's what we would want to be. Australia is 9%. Most of Europe be about 9%. So if we were at 9%, then we'd be in a much better position to be able to deal with this backlog now. The fact that we have underinvested in radiotherapy over the last, couple of decades is a reason why we've struggled to catch up and keep up with cancer during the pandemic.
Right, because that would be something some people could have done during the lockdown. It wasn't chemotherapy.
And it's a thing that they could do. Yeah, absolutely. And it's also something that we could be doing more generally. I mean, so obviously before the pandemic happened, the NHS long-term plan included something absolutely laudable, which I totally support, which is acknowledging that the UK has some of the worst cancer survival rates in Europe, acknowledging that the way to deal with that is to diagnose people early, therefore you can treat them and cure them, and to therefore emphasize the importance of early diagnosis. The problem is that if you're successful with that, and clearly for understandable reasons, in part during the pandemic, that's not been so possible. People are diagnosed late now, not early. But that aside, if you do diagnose tens of thousands of people earlier than normal and you can treat them, hooray, where's the kits to treat them with? And
well, so we need have you got a figure for it? That 9%, we're spending, what did you say, 2%?
Sorry. No, 5%. We spend about 5%.
So we need to up that. And so in sheer numbers, what's that about?
If I were to take a stab, I'd say that you'd probably need to spend something in the region of another 100 to 150 million a year. But in the scheme of things, that's nothing.
Yeah.
Half the cost of one drug in addition to the radiotherapy budget, and you'd be in a much better position. So first of all, there are so many machines that are out of date or should be out of date. But you've also got plenty of areas. And what motivated me in the first place to get involved in all this, apart from the fact that obviously I had family members who lived with cancer and indeed died from cancer, was just that my community in Westmoreland is huge. It's bigger than the whole of Greater London, and there's no availability of radiotherapy in my constituency at all. You've got to travel all the way down to Preston to get it. And one of the answers, not the only one, but one of the answers to the problem is to make sure you have satellite radiotherapy units in these sort of semi-rural areas. So, in the northwest of England, you could solve two of the biggest black spots by just putting, a linear accelerator or two at Kendal behind me, and actually one out at Burnley in East Lancashire to cover that kind of area, which is totally uncovered in the east of the county, just south of here. And so probably a dozen of those around the country would help to make sure there was nobody living so far from radiotherapy that they weren't able to get it.
Yeah, not able to get it was with the question I was asked. Do you have constituents who are too sick to actually travel that far, or actually just don't want to put themselves?
Yeah, we do. I mean, so there's two things. Obviously, there are many people. If it's a life-saving thing, people will, whatever the hardship, they'll go and do it. Radiotherapy is not something you go for once. I think people understand traveling, many, many, many miles for an operation. But to be going every day for 5-6 weeks or something like that, that absolutely wears people out when they're ill to start off with. So there is a convenience issue, but convenience is too light a word to use. But definitely at the margins, you see people choosing to end or not start their treatment because of how far they'd have to go. And I'm always careful about saying this because I don't want anybody to think I'm criticizing any medic here. I'm really not. If you are, an 85-year-old person with cancer and you live in, the town of Garstang, which is 10 miles north of Preston Hospital, and you're told that you need 6 weeks of radiotherapy, then, and I'm your doctor, I'll probably say, do that. That's doable. But if you're living in Grasmere and it is a 3-hour round trip every day for 6 weeks, and you're that sort of age and you're frail, I might think, do you know what, on balance, I don't, yes, this might prolong your life, but it also might do you more harm than good because of the traveling. I'm not going to recommend it to you. And I'm not criticizing that medic, by the way. They're just reacting to the sad reality that the government's left them with. What we actually need is that 85-year-old in Grasmere to be able to make a similar size journey as the one from Garstang.
So, yeah, why do you think there has been this lack of focus when it is so patently obvious? As you said, it was clear that it might happen. I remember Professor Pat Price said, I can see what's going to happen with this unless we do something now. And you were warning way back. What's gone wrong? Why is there some kind of deafness to this?
I think it's a reminder of how important a lobby is, how important it is to campaign and to make a fuss and to have people in the room when decisions are being made. So I am the least conspiracy theory person on the planet, right? I don't think big pharma is instinctively or just naturally evil and all the rest of it. But it's a huge, multi-billion pound business, and they lobby effectively. I regularly get letters from people saying we should legalize or commission and pay for this drug or that drug to deal with one illness or another. And I'm sure they're right, and I'll get behind those campaigns. I never see anything like that on radiotherapy. And the point is the radiotherapy industry is small. And when I set up the all-party group on radiotherapy, 3 years ago now, me and another MP, I think 3 of us actually in total, in a hot little room in the House of Commons, we expected it to be half a dozen people, so Professor Pat Price and 1 or 2 other people who might come along. This room was absolutely packed with the country's top cancer clinicians. I was utterly humbled with the expertise and the life-saving prowess of the people who are crammed into that room. And the reason is there isn't, or there wasn't, a radiotherapy lobby. And so ministers are not having their ears chewed off day after day by people saying, why are we not investing? Why are we not building these machines? Why are we not deploying these machines? They are from, the pharmaceutical industry. And I'm not saying the pharmaceutical industry is wrong to do that. No, but I think ministers are wrong to not understand that an imbalance of lobbying can make imbalanced and poor decisions.
But looking at the whole cancer, and I don't know whether you've seen probably figures, and I don't know whether you have your own estimates, but I think Professor Sakura was talking to me in a podcast last week who said that there may be up to 40,000 excess cancer deaths this year and up to 30,000 next. We don't really know. We know that in terms of life years, it would have been worthwhile at least investing more in cancer care and heart disease care. So in the broader issue, not just on radiotherapy, what's going wrong? Why is cancer not being prioritized, this catch up? It's not just radiotherapy. Do we need hubs to diagnose people? I mean, that's a separate question, but why not? It's so obvious that it's happening.
I mean, I think Professor Sakura is right. He's obviously far more of an expert than I'm ever going to be, but the figures that he cites are similar to the ones cited by Macmillan and Cancer Research UK. And, so the estimate is something in the region of 40,000 excess deaths. I'll go back to, indeed, in that first year, and year on year, it's potentially going to get worse. Mm-hmm. I think that, again, I go back to, I'm keen not to say this is all the government's fault. Some of it is down to the virus. And I think that people would have self-policed if there'd not been a top-down lockdown. I think they just would have done. It would have been chaotic. And actually, the age groups and demographics more likely to have cancer were probably the ones that did it the most. So I think sorry.
Well, I was only going to pick you up on that because I went out to Sweden and met Anders Tegnell, the epidemiologist, who really was, agreed with this approach. And obviously the data is very mixed from around the world about whether lockdowns save more lives or not. But when you have mixed data, then it becomes very unclear with the damage that they cause, how effective they have been. And I suppose you've seen evidence as well that people do respond, don't they? They know that they need to shield, and if they don't want to, and they're happy to take that risk. I mean, perhaps as a Liberal Democrat, and I don't know whether it's, fair to say that you are in favour of sort of less enforcement, less top down. Did you feel kind of instinctively throughout that perhaps we did have too much of a heavy hand on the public, and that we perhaps, protection for civil liberties and people's making their own minds up would have been a way to go, and perhaps with the benefit of hindsight as well? I mean, we can't blame everything we didn't know right at the start, but what do you feel?
Yeah, really good questions. So the first thing to say, I think being British has saved hundreds of thousands of lives. And what I mean by that is that we abide by rules, don't we? And I say this in a loving and affectionate way. We're a nation of curtain twitchers. We have a habit of disapproving of our neighbours and being terrified of being disapproved of. And so I think that has saved hundreds of thousands of lives in this country. In terms of
a colossal death toll. I mean, do you really believe that people? Yeah, we don't know. I mean, there's no good evidence. There's no evidence that about mask wearing in the community make any difference. I know it's a difficult subject. We don't want to go there, but in community-based mask wearing doesn't have any evidence. Social distancing, even still, we don't really know. There's so much we don't know. Do you really believe that people don't want to be seen to be doing the wrong thing, and that has actually saved lives? Or do you think people would have, had we had a soft approach, given people information, like with the AIDS pandemic, we had, those tombstones, and I know this chief medical officer there said, we take down those, we don't use fear, we teach people, we educate them. I know the transmission's obviously completely different, but we teach people how they should behave and take people with us. Is that not something that you think could have worked here, a different approach altogether?
Well, I think that so obviously there have been laws, but most people haven't had, 99% of people haven't needed the police to enforce their behaviour, or even the law to enforce their behaviour. It's been the sense that we as a society have bought into this, and you do this or you are, you're not a good sort, you're not a good neighbour. And so I think that obviously, I'm no epidemiologist, I'm no expert, but full well that even with, more common illnesses before this pandemic, that washing your hands, not breathing on people, keeping your distance, it's fairly common sense, really. And to have it built into our lifestyle the way it has, you just need to look at the graph of the infection rates over the last 12 months or more, and see the kind of feed-in period of relaxations with increases in infections, to see that it definitely has an impact.
Yeah, it has an impact. Yeah, the correlation, the lockdowns.
I think the question you make about, but I make a genuinely affectionate and mostly serious point about, I think our culture has helped us through this to extent, and I think that's actually helped us when the messaging has been unclear and the government has led poorly and done a bad job. I think that the country has led itself. And I think we should be really, really proud of ourselves. And there's things about our culture we might not like. There's things about our culture I do like. And I think there is a sense in which we want to be good neighbours. We want to be seen to be good neighbours. And I think that's something we should all, take credit for collectively. On the issue about liberalism, and I think you're absolutely right. And so there's, there is a difference between being a liberal and a libertarian. A libertarian says, do what you like. A liberal says, do what you like until it hurts somebody else. And there's a competing set of freedoms there. And obviously there is, for the greater good, there is a case to be made for, submitting some, cashing in some liberties temporarily. And the reason why I voted against the extension of the powers last week, and, all of my party did as well, is because we are liberal. Because I think that the government was asking for powers it didn't need for longer than it would have needed them for anyway, and that the guidance was sufficient. And I think that what we've got is a government that does an awful lot of talking about liberty. That's kind of core to its narrative. But the minute that the rubber hits the road, they're not liberals or libertarians. They're authoritarian in their instinct. And if it was only this as a one-off, you could perhaps excuse it maybe. But it came in the same week as we had the crime and sentencing bill, where people get locked up for up to 10 years for just disagreeing with the government. And any old fascist can defend the rights of people they agree with. It takes a liberal to defend the rights of people you don't agree with. And then at the same time, this nonsense about publicans. I've just written to the PM with one of our landlords here in Kendal to say that, you wouldn't be allowed even in the outdoors of a pub if you've not been vaccinated. Given the age profile of, the people who, frequent pubs and work in pubs, they're not going to be vaccinated, a lot of them, in the 2 weeks' time before it opens. And then you've got this business about carers being told that by law, they have to be vaccinated. Well, they are getting vaccinated by choice because they're good people who want to do their jobs well and take care of people.
Passports, that's a really hot topic, isn't it? But what do you feel about the immunity passports?
Yeah, I understand there may be some inevitability when it comes to international travel. I don't like it. But domestically, I think it stinks. I think that, yes, everyone should get vaccinated. It happened to me. It felt like I got a cricket ball hit on my arm for a day or so. It's fine. And it's absolutely the right thing to do. Everybody should go and get vaccinated. But to make them do it, to lock them out of society at this stage just feels, again, very un-British. Yeah.
So why does it feel un-British to coerce people to get vaccinated?
Because I think this is where we get down to whether this is about cultural individual change in the long run or whether it's about, government policy. And surely we want written into our DNA as a species and certainly as a nation, as a people, care for your neighbour. And, your neighbour's everybody. And that means getting vaccinated is just the right thing to do.
But I'm saying,
and the evidence is that people are doing it. So the idea that we treat people like naughty kids when actually they're doing the right thing anyway, just as I say, it doesn't feel very liberal. It doesn't feel very necessary. 95% of people over 60 have had a vaccination. Now, if we'd been through the country and there was still 40% who were resisting, then you could perhaps understand. But that's not the case. People are getting vaccinated.
You would feel that once we vaccinated those vulnerable groups, then we should be in a position to say, look, for everyone else, do it if you can, but we're not going to coerce you or actually make that a legal requirement or shut you out of society. Is that what you mean?
I think, so first of all, I think when we get down the age groups, people will get, I see no reason why, the under 50s, under 40s, under 30s are going to be any more reluctant to get vaccinated than the over 50s, 60s, 70s, 80s, 90s. And so and there's no evidence as we come down the age groups since this all began in December with the vaccinations that, younger age groups are more reluctant to get vaccinated.
Would your party vote against vaccine passports just for on the basis that it's against core principles?
Well, I certainly think that we managed to make massive progress so far without coercing anyone. No one who's 90 or 80 has been told you must be vaccinated, but try holding them back. So people have turned up and have been vaccinated. So I think the need for coercion just isn't there anyway. It would feel wrong in any event.
And I know Michael Gove had a Zoom call, didn't he, with some of your colleagues. So, will you actually say, well, we don't agree with this? There are lots of reasons why we don't want to do this at this stage.
Yes, I think the idea of a vaccine passport, certainly domestically, just seems wrong and seems unnecessary. Particularly when you see the number of people who have been vaccinated. Of those people who've been offered the vaccine, something like 95% have taken it up, and that is more than sufficient. And that, as we work through the age groups, I think that will keep up. I think obviously there's an argument once we've got everybody over 50 vaccinated, certainly twice. Then, that's all the age groups where 99.9% of fatalities have happened. And surely then shouldn't we unlock? And I think on face value, the answer to that is yes. Slightly more complex is, of course, that we know the vaccine works against the strains that we've got. And the problem is a whole bunch of people who are younger could pass the disease symptom-free to one another and see new variants develop as a consequence. And that might end up breaking the wall that is the vaccine. That's the theory. What do I know? I have a grade C in biology O level. But I do think that that does sound plausible. And it's why I think the government would be wise to be erring on the side of caution when it comes to the advice. But it does not need to err on the side of intrusion when it comes to laws and restrictions on our liberties.
You might want to put some points across about what do we need to do now?
There needs to be a plan to catch up with cancer, and the cancer recovery plan was inadequate, and it has now expired, or it expires at the end of March. And so there needs to be somebody put in charge of, in the same way the vaccination programme was given its own minister and has been successful by having a single reporting structure and it being seen as a project that the government was just going to make sure it ran well. We need the same approach to cancer. We always need the same approach to cancer, but we specifically need it now to see this as a kind of 18-month, 2-year project starting kind of yesterday, with resources committed to it when it comes to diagnostics and it comes to treatment. So to put bluntly, there wasn't a single mention of cancer anywhere in the budget, nor any additional money to catch up with cancer in the budget. In the comprehensive spending review in the autumn, there was one mention of cancer. There was some money, but all it was to replace knackered, out-of-date diagnostic equipment. There was not any more. There was no net gain for diagnostics, just some replacement kit, and not a thing, not a bolt, not a penny for anything to do with treatment. And those are the things that you could do. It is science. It's not rocket science.
So on mental health?
Well, in both mental and physical health, so much of it is down to the availability of a skilled workforce. And so solving it overnight is really tough. Yeah. And so what you should be doing is investing in a new generation of people who can work with young people of all ages when it comes to mental health conditions. We've got quicker access to better treatment. But I think the other thing that's vitally important is that we use the skills and the abilities we've got now. So here am I, up in the Lake District, and we are home to many of the country's most important outdoor education centres. Yeah. And outdoor education is a critical part of young people's learning. What it does, amongst other things, is help to get young people to discover that actually they love learning and they can love learning. You build your confidence, it helps to build resilience so that when tough things happen, you're more likely to get through them in one piece. And so here we have outdoor education centres that have been absolutely crippled over the last 12 months. The government has only just given them an indicative reopening date in the coming weeks, months, and it's given them no specialist funding. What I think they should do is give them those things, but also look at outdoor education centres and think this is a skill set to deploy right into schools in different ways to make sure we just connect with young people. Never mind, cramming up with additional summer schools that might actually worsen young people's mental health, probably do no educational good. Invest time in the coming weeks and months in just giving kids that opportunity to rethink what it is to learn and to rediscover a love of learning from the very hands of the people who are just best at it.
And we could lose some of those, couldn't we? I think you've done some work on that, showing up to 40%, I think, may have to actually close, something like that.
We've the assessment is that there were 15,000 people who worked in the outdoor education centre, and of those 15,000, 6,000 already lost their jobs. And since that figure came out, a centre close to me with just 14 staff lost 6 of them. So it's getting worse all the time. The government has this last week done something we've been asking for months and give us an indicative date on the roadmap. So there was no roadmap date for outdoor education until the end of last week. So that is something.
Your reservations about extending the powers on Coronavirus Act, would you have thought those powers were too sweeping earlier on, or is it just about now that you think actually that this has gone too far? Or had you had reservations before? At what point? What things do you think are excessive?
Well, obviously we had reservations right from the beginning, although you understand as a pandemic explodes in front of you and you see the fear of what might be coming, and we read all that was going on in northern Italy over 13 months ago now, why those powers were considered. But it's one of the reasons why we pushed back at the beginning and demanded that Parliament should review them regularly. You remember, originally the government were putting those powers to the House to have them indefinitely. And so Liberal Democrats are amongst those who said, no, you can't have that. So we didn't vote for the renewal in October. We voted against the renewal most recently, because I think they're unnecessary and they're an overreach, and they are powers that are greater than the government needs for longer than it needs them.
And have you got any specific examples of which ones you are particularly aggrieved about?
Well, obviously, I think that all this stuff about, I'm someone who believes that, peaceful protest is really important, whatever your opinion. In a free society, it should be allowed. And I think to be, for a government to look like it's protecting itself from those people who disagree with it, it always stinks. That really is a first sign of you slipping into a rather dangerous form of authoritarianism. I make no negative comment on Keir Starmer, but I think his approach to succeeding Jeremy Corbyn is to try to be maybe a little bit too neutral on important issues, scared that Jeremy Corbyn was not so neutral on important issues. So I understand the motivation of the Labour Party, but it does sometimes rob us of an opposition.
Do you think it did become a left-right sort of issue about, how coronavirus and the act was seen? Do you think there was a party political?
No, I think it's a liberal authoritarian split, not a left-right one. You find people on the in the Conservative Party and the Labour Party who instinctively kind of think it's their job to run everyone's lives, agreeing with each other quite easily. It was the Liberals who found this really angst-ridden as a decision. We understood in the first place why it was necessary. We think that the restrictions are, the laws that the government passed that gives them the ability to interfere and control people's lives. As I say, it's an overreach and for too long.
So do you think we're moving towards a totalitarian state? Lord Sumption has expressed concern about that. And is that a worry for you?
I don't want to overstate the risk. I think it's kind of important to remember, though, that governments can tend to rather enjoy having powers they said initially that they didn't need for that long, and get used to being in control of people's lives in ways that I think under normal circumstances we would never consider to be acceptable. And so I do worry about this government's instincts when it comes to freedom and liberty, because I think that, we often hear the rhetoric of freedom coming from the lips of people who practice it the least.